today talking about my thesis project, which was the use of peer youth educators for the promotion of adolescent sexual health, and I worked at Carolina for Kibera. So the two main study objectives of my project were, one, to understand how exactly the peer educator model was working at CFK in a very logistical kind of way, and also to think about the benefits and barriers to CFK's choice of model for their promotion of adolescent sexual health. So just by the way of introduction and background, the health topic that is the subject of this paper is adolescent sexual health. So the burden of disease is rather large in adolescent sexual health. It's tied up with things like HIV and STIs, abortion complications for people who don't have access to abortions, or in countries where abortions are illegal, maternal health complications, and this is especially important in Kenya, where half the population is under the age of 15 years old. The social factors really contribute and worsen things with adolescent sexual health. These include pressures to have sex, early marriage and early sexual debut, gender-based violence, transactional sex, and then, of course, multiple and concurrent partnerships. The important thing about these social factors, especially with this particular age group, is that they're particularly susceptible to peer pressures and to the societal norms that are going on around them. So the societal norms around this particular area really impact adolescents' both decisions and then what happens to them as well. And then, of course, the governing attitudes and policies of things like the government, institutions, and then, of course, the authority figures that are around them really impact their ability to make decisions and then the choices that they make. So peer education is one model of organizations that organizations use and governments use to try to figure out how the heck they're going to deal with improving adolescent sexual health. So peer education means a lot of different things to a lot of different people. Organizations define peer and education very differently, depending on the context, depending on the program objective. But in general, it means a member of a group attempting to administer to the same group. They're used in both behavior change and information exchange initiatives, from things like smoking cessation to, of course, this topic, which is like sexual health, to diet and things like that. And the cool thing about peer education is you can affect change both at the individual level and at the societal level. So the initial response to the HIV epidemic was primarily at the individual level, where we kind of thought, okay, well, if we teach everyone the information about how to contract HIV, they'll make the decision not to do it. But that didn't work out so well. So now we're kind of focusing towards societal level interventions. So this includes things like peer education, where you're trying to change those social norms and expectations. And the literature really shows that this is really an effective way to share information, but the literature is also really mixed on the effectiveness of changing behaviors with this particular model. So the peer education also fits in with the emphasis of participatory development and community-led development, both of which are hot topics and trends in the international development world at the moment. So where I worked was Kibera, which is a large urban slum in Nairobi. It's not on the outskirts by any means. It's only 3 miles from the city center, located right in the capital. And it's split into 12 to 13 villages, depending on who you're talking to. And this is the map right here. The star indicates where CFK's, or Carolina for Kibera's, headquarters are located at. So they're right in the middle. Kibera is about the size of Central Park in New York, and depending on who you're talking to, they're going to tell you something completely different about how many people live there. I heard ranges from 170,000 to 1 million, and even somebody told me 1.5 million people. But it really changes depending on the day. People are moving in, moving out, and moving within on a very minute-by-minute basis. So it's a very diverse and very transient population. There's an extreme lack of services. This is primarily services that are expected to be provided by the state, like water, electricity, sanitation, things like this. And if these are provided, they're generally always only provided by NGO effort or even community efforts. So this is just one picture here, just to kind of give you a sampling. And then, of course, the famous picture of the railroad tracks that go through. These are active railroad tracks. There's two. You can take if you take the train from Kampala to the coast, you will go right through here. Kampala, Uganda, I should say. So it turns out that adolescents in Kibera are just pretty much the same in many, many ways as adolescents in Durham. They're crazy, they're funky, they're energetic, they make silly faces, and they're shy, just like Durham adolescents. The adolescents in Kibera are different in many important ways, though, in that they're dependent on day labor a lot of the time. Many are schooled, but this depends on their age and their access to the education. But importantly, the one study showed that in 2010, a sampling of 2,000 adolescents showed that the adolescents in Kibera become sexually active 5 years before people living, like a stone's throw away. So they really are a unique population. And also that they have an HIV rate of about 3 times their neighbors down the road who don't live in the slum. Adolescents in Kibera are sexually active, not always by choice. So here we have, about a third of the girls here are indicating that they wanted to have sex the first time they had sex. The other third are saying they did not want to have sex the first time they had sex, and a third are undecided about their wantedness. And then here we have a breakdown of all the different ways of motivation for first sex. But really showing that any form of coercion is about half the time that people initiated into sex were through some way of coercion. And there really is a lot of really stunningly low use of contraceptives. Here we see that about half of the population, adolescent population, has ever used a contraceptive device, like ever. So this shows pretty startlingly low contraceptive use here. So I worked with Carolina for Kibera. This is my partnering organization. It was founded in about 10 years old by a UNC student and a Kenyan nurse and a Kenyan Kenyan youth leader. I started with sports initiatives, soccer, obviously, a small health clinic with a directive of trying to deal with tribal tension and then also provide health care. They continue to be focused on youth development, although not wholly, and then they pride themselves in being very community-led. If you have any more questions about CFA, you can go to their website. It's very good. This is the original sign for the clinic here in the corner. Although the clinic is very different now, we can talk about that later if you want to hear that story. So the particular program that I worked with was the SRH program within Carolina for Kibera. SRH stands for Sexual Reproductive Health. Now this is one little effort within the broader health department within an organization that has several departments. So just kind of one effort. It was started in 2006 with a grant from the Planned Parenthood Federation of America International. This was a 5-year grant. And the target population is the entirety of Kibera. So if you think about those population numbers that we talked about, this could be a target population of anywhere between like 60 and 600,000 people. The original goal was to both add services and information to what their original efforts were at that time, but also to integrate all of the existing services under one umbrella. And they chose the peer use model because it's in keeping, or they figured it was in keeping with the organizational priority of youth development and also the organizational priority of community-led development. So here I am. They also have a Duke flag in there, so don't worry. And this is in their office. The opportunity for this study came along with a connection with Kim Chapman-Page, who I don't know if any of you guys know, but she served as a longtime leader with them, and it came through a collection of these 3 things. So there's been an increased emphasis of monitoring evaluation at the organization. The SRH grant had come to an end at the end of the 5 years while I was there, July 1st, that it came to an end. And then also a continued need and a continued importance on the sexual health of youth around in Kibera. So that all these 3 things kind of combined into my project. So where this project fits into the literature, the project is unique in a couple different ways. One, in that it provides a case study, in that it really brings out all of the details and illuminates one organization's experience with this particular model. In a dynamic environment, most of the literature focuses on peer education in a closed setting, so like in a school, in a place of employment, with a particular community, but they have really chosen to include all of these people, very different and very dynamic and diverse situation. And then the second way that the project is unique is that we really tried to figure out context, how program interacts with the context of Kibera, both in that how Kibera necessitates certain planning ideas, certain implementation ideas, and how the context really figures out how it's going to be successful or not successful. And this is, the literature really shows that programs that really take into consideration their context and really specify to their specific context really can determine a program's success. So the method for this project was the triangulation triangulation, and the 3 things that were used were document review, which I went through the documents that existed, researcher observation and participation, so I went and talked, I was at the meetings, I went and talked to the people who were involved, went to activities, things like this, but the primary method was the qualitative interviews and the qualitative focus groups. These are a list of the interviews and focus groups that were included in the data. We have 3 sets of groups of people, populations that were used. The yellow denotes program staff, the green is peer educators, both inactive and active, and red is beneficiaries and community members. So I think it's important to note 2 things. One, that the methodology was really created in collaboration with the program staff. So it wasn't set out at the very beginning of who was going to be interviewed what and with which questions. It was very much an iterative process where we went through and tried to determine what was most interesting at what point and who to talk to at what point, and as things came up through the interviews and created, because we needed to be a project that was at the very, most importantly, useful to the organization. So, and then also that this is just a very small snapshot of, or a very small chunk of what I did this summer. So if you guys have other questions about my fieldwork experience in general, we can talk about that later. But this is just one little chunk of what happened. Are there any questions at this point? I know that was like a whole bomb I should have mentioned. Yeah.
Did you do your collaboration to get this information through Skype or?
No, once I was there.
Once you were there. So how did you get that approved by RV beforehand?
Right. So. The project that I aimed to do when I first went to Kenya was not the project that I ended up doing. So when I arrived on the ground, it became apparent that the project I wanted to do wasn't really viable. So instead, we switched gears to more of a program assessment. So at first, we wanted to do a process evaluation where you compare and contrast the plan to what actually happened. But when it became pretty apparent that there wasn't ever actually a concrete plan that I could compare things to, we kind of moved towards the program assessment. So I completed the fieldwork and so this is just a small, I have more focus groups and more interviews than this in my personal collections. This is just the stuff that I used for this particular paper. So we kind of switched gears to an entire program assessment, and then when I came home and I had all this data, it was okay, how am I going to use this data, and how am I going to figure out what's an interesting question to ask? And it's very backwards, and it's not what you're supposed to do, I guess, but this is just how it happened. Does that answer your question?
And then you submitted it to the IRB after, because your analysis, don't you?
No, I mean my analysis didn't. So the people I interviewed didn't change. The how I interviewed them didn't change.
Oh, okay.
My consent forms didn't change. Any of that kind of stuff that the IRB would be concerned with didn't change. So I still consented with the staff and assented with the peer educators and all these different things with the IRB. That process didn't change, but the question changed.
How did you decide how many interviews to do? Because that's sort of something I've been struggling with.
Right. You get to the point where if you are hearing the same answer over and over and over again, it's no longer useful to keep interviewing. You also for me, it was kind of a lot to do with the program staff, what they wanted to hear and what they wanted to know. I mean, I conducted the interviews all by myself, just so that the people understood that there wasn't a conflict of interest. But you can kind of feel through that when you get there, because you can understand, I'm getting the same thing, and 12 people are telling me the same exact thing, I probably don't need to interview number 13. But for my case, I didn't ask many questions to same questions to different people, so there wasn't a lot of compare and contrast. So there's a lot of different people who were interviewed for a lot of different reasons. So the data isn't really compared and contrast, which you'll see in a second. So I think I'll keep going. So the results can be thought, the results can be thought of in 3 chunks. It's probably more academic way of saying chunks, but we'll think about it in 3 chunks. So the results can be thought about in the first part is the program description, in which we think about how the program's actually working. The program assessment, thinking about how things are working well or not well, and why if this is a good choice for CFK to use this particular model. And then the third part is the most interesting part to me, which is the context building part. How is the program interacting with the very specific context of Kibera to both meet the needs and to adjust to different trends, both in the planning and implementation stages. Does that make sense? So the first part is the program descriptions. We're going to think about how the program is actually working. So the original goal of the SRH program is to integrate and add services. The PPFA, the funding agency, provided money for a CAP survey at the very beginning to provide as a baseline, although there wasn't ever any baseline. Indicates that there was follow-up, but there wasn't ever follow-up, but there was a major baseline done. This is through a knowledge, attitudes, and practice survey, which if you don't know what they are now, you will find out at some point. And the CAP survey showed us a few interesting things. This was done in 2006. First, that adolescents are having sex around the age of 14, but also the qualitative part shows that when asked what they really needed and what they really wanted out of a program, almost all the adolescents, over 80%, said we want a program that is administered to us by our peers. So that kind of backed up CFK's decision to go with their peer education model. So the original guiding mission is to provide both services and information to reduce the burden of disease in this particular area, but also to provide capacity building within the organization itself. This mission has never been changed since 2006 formally, although the current activities are very different and a lot more broad than what this particular mission would suggest. So how the peer youth educator model works at CFK. CFK has currently about 13 active peer youth educators, although between 40 and 60 have been trained over time. About half are male, half are born in Kibera, about half live with somebody else than their parents. It's pretty reflective, I think, of the adolescents in general. They are recruited informally and formally through friends, through events, through posters. And here we have two quotes about why people join the program. The first one is pretty indicative of the male perspective. I got this from a lot of male peer youth educators, in that they really wanted to join the program to keep themselves out of negative influence, understanding that if they were to remain in the community, they probably would go in a negative direction. And then the second is, everybody told me this, that they wanted to join because they wanted to help their fellow youths. So the training includes a 2-week session. First is an introduction to CFK, and the second is content training, and then also how to be a peer youth educator, so how to speak in public, how to administer one-on-one counseling, how to be a leader, things like this. And retention is an interesting issue. It's not alone just the SRH program in particular, but because there's not a specific phase-out date, people who are in the program since the beginning. There's been several people who were within that 2006. About 9 of the 13 have been recruited in 2006. So people are in the program for a really long time because there's not like a phase-out period. Within the 40 to 60 people who've been trained, there's obviously only 13 active. And only one person has been kicked out of the program or officially phased out is what they said. The rest are out of the program for 3 reasons, or no longer active for primarily 3 reasons. 1, they went to school. 2, they got a job. Or 3, they had a baby themselves. So the activities that are involved are school, are listed here. 2 interesting ones are the community-based distribution, in which the peer youth educators are trained to do one-on-one counseling, but also are given an amount of supplies to keep at their own place of living, and their neighbors and their friends know, okay, well, Chelsea has condoms at her house, so if they need them, they'll come over there and grab them from Chelsea, and then I'll administer one-on-one kind of thing. And then also that there's a lot of SRH activities that happen even beyond the scope of the peer youth educators. These primarily include things that happen at the clinic, like post-abortive care and emergency contraceptives, and the activities involved with the VCT, the Voluntary Counseling and Testing Centers. Just to briefly run through the logistics, there's a program officer, 2 HTC counselors, which is the new way of saying VCT counselors, Voluntary Counseling and Testing Counselors, a reproductive health nursing officer. And then within the peers themselves, they've elected 2 leaders to serve as book liaison between peers and the staff, but they also are wholly in charge of implementing all of the activities. And this is a decision that we'll get to a little bit later. They're given 1,000 shillings a month for their participation, which is about $12 a month, and then 100 shillings on top of that for activity, which is called their lunch money, but it doesn't really matter if it's in the morning or evening, or if it's 2 hours or 7 hours, they're always given 100 shillings for their activity. And then if you're a peer leader, you get 3,000 shillings extra. That's the most condensed version of the logistics of this program ever. So the second part of the results is the assessment findings. So what's working well, what's not working well. And this is the assessment. It's broken up into these 5 issues here, which we'll go through. So these questions were framed as like, what's working well programmatically, like leave alone the context, we'll get there in a second, but programmatically, what's going well, what's not going well. So first, like the training, lack of training, peers felt like they weren't trained properly, or because there's not a set curriculum, everyone's trained differently. You know, you might know a lot about abortion and you might know a lot about birth control, so people are trained really differently. The second would be like a gender imbalance in the participation of peer youth educators, so the males are much more likely to show up to things, they're much more likely to participate in discussion and activities. It's really difficult to get the women, even though they're like part of the program, to participate. The commodity shortage is always an issue, because they're relying on the government and then through their donors to get their commodities such as HIV tests, condoms, things like this. And then peer youth educator follow-through is always an issue as well. People don't show up for a variety of reasons, which we'll get to in a second. So leadership and decision-making came up as an issue over and over and over again, but in 2 different ways. The staff really see their leadership and their decision-making going really well. They think they make decisions as teams, they collaborate with peer youth educators, like the program officers decided to delegate tasks as a way of making leaders, although this is, according to the peer youth educators, backfiring on this person. So they think the leadership is poor, things aren't going well, they can't communicate with the staff, they're looked down upon by the other volunteers because they're not paid as well and there's not a set up ladder of improvement. And so it's kind of this, but even though like the economy between these 2 groups shows that at least there is some sort of issue, even if one of these groups is not right. So the third issue that came out of the program assessment was the lack of monitoring and evaluation. Each activity is tracked with a tracking tool, but this tool basically is a worksheet that every peer youth educator has to write out, where the event was, how long it took place, how many people showed up, and then very briefly like what worked and what didn't. And then every contribution is tracked from the peer youth educators, but there isn't a quota for any of this stuff. So there's not a quota for like how many school visits they have to do or how many any of this stuff that they have to do. So there's not very much evidence that any of this data is really being used in future planning, even though these efforts are being made. There are evaluation meetings that are held monthly, but again, there's not that much effort or not much data to suggest that they're actually that this data is going through again.
So they're not necessarily like taking the data and trying to look and see what works, or like do any of that kind of stuff.
Right. So like the way that it works is that they're given a yearly plan with like certain objectives, and then from the yearly plan they're given make quarterly plans with certain objectives. But if nothing's made, if the quotas aren't made, there's no consequence. It's like, okay, well we only did 50 of 75. Why did that happen? Well, it rained for 2 weeks. Okay, so then things aren't they're adjusted on year-to-year basis rather than like quarter-to-quarter basis, which can lose a lot of impact, I think. Peer development versus peer delivery is a balance that every organization that uses this model is going to have to think about. So an organization has X amount of resources, including financial resources, human resources, all these different things. And so they're going to have to think about how many resources do you put into developing your peer leaders, and how much resources are you going to put into the actual delivery of the program. Now, this balance is played out very differently in different organizations, but the balance actually it can impact your program. So not surprisingly, the main thing that comes out of this balance from the peer youth educators is there is a contention over stipend, where they think they need to be paid more. And this is an interesting idea because they all understand going into the program how much they're going to be paid, and that this won't change, and that their resources are, that CFK's resources are finite, all these things, but they still expect a lot of the organization. So this kind of discrepancy in motivation really is an interesting point to me. There's a lot of unmet needs beyond salary. They expect a lot from the organization, but the program officer explains this away as just being adolescents. They're adolescents. They need jobs. They need money. Perhaps they need funding for themselves or their school fees or their own dependents. So the staff isn't as worried about this. And also importantly, the focus group versus the interview data is very different on this, where when it was just one-on-one, nobody had a problem with leadership, nobody had a problem with decision-making, nobody really had a problem with the stipend, but in a group, you got to get this collective, like, naysaying kind of going, and it gets bigger and bigger and bigger. So that kind of discrepancy also can be thought about as far as future planning. So these are two quotes about the balance that we have. And the first shows that the program officer really is putting in, he's really weighing in heavily on the balance of being on creating the leaders. This is his primary objective, is to create the leaders, as seen in red here. And the second one is a recounting of a story of where this fellow was the youth leader, and he was in charge of getting everybody to complete a task, complete an activity like a school talk. But he left the lunch money at home. And when the peer educators came to do the project and they found out they weren't going to be given free lunch, they literally all went home. So this is also a discrepancy, an interesting part about the thinking about the motivation to join this kind of program. So, but beyond this kind of debacle about the salary, there are a lot of benefits to being a peer educator, as are listed here. These are all given to me by the peers themselves. And they are notably very proud. They're proud to be associated with Carolina for Kibera. They're proud to be peers educator. So although we have all this negative focus group data, there are a lot of benefits and spoken benefits to their participation here. So the community perspective was a very much a secondary outcome because I only interviewed about 10 people. It was very difficult to find and really wasn't a heavy outcome of our project. So their mothers really liked them being involved because they really liked CFK and they really liked that they were being involved in something. But the beneficiaries themselves, so the community members themselves, really had two interesting things to say. One, that they really bought into the peer model. They really liked that they were being administered to by their peers, but also that the peers weren't walking the walk and talking the talk. They maybe were acting out in the community because Kibera is very large and very intertwined and it's very, a lot of commotion. People are no people, even though there could be 1.5 million people, and they're not living up to what they're saying. As is noted here by this picture of one of the peer youth educators with holding the baby of another peer youth educator. Well, any questions about the program assessment part? Okay. So we'll move into the contextual issues here. So we're going to think about what is going on in the community that's impacting implementation. Because Kibera is very unique, and that is, some people say it's the largest slum in Africa, although many people say that's Soweto and Johannesburg, but to me it seems like a very strange thing to be arguing about, so I won't spend time on that. So there are the contextual issues really that are impacting the program success are like the sexual health of youth. We really find evidence that these assumptions really are backing up what the reasons to do the peer model. They're sexually active. There's a lot of early pregnancy. They get their information from their peers, and there still really is a need for sexual health initiatives. Here we have a quote from a female peer youth educator about how she gets her information about sexual health. She really gets it from her buddies, from her friends. And then here in red we have the essential conundrum of every health behavior scientist ever thinking about, well, some people don't have the information, but some people do, and they just choose not to do it anyway, or they choose the risky behavior anyway. So this is kind of the central point to many health behavior scientists all around the world. There's some themes that come out about the community life that impact implementation. These include all these things listed here. Importantly, the transitory populations. It's very difficult to track people for their one-on-one activities, and males are more likely to participate in activities, as in they'll come by the hundreds and you won't get a single female. The gender imbalance implications, like I talked about early in marriage, transactional sex, sexual violence, all these things. And then the mud and distances between villages really plays to that their catchment area really is the entirety of Kibera. So administering to people who live 4 hours away from each other by foot is a very difficult task. And when I asked them what they needed beyond anything, they all said they needed gum boots, which is what is like mud boots. Like they really needed some wellies. Like if they could just have wellies, their jobs would just be awesome. So because they call it's not really mud, it's just kind of slum mud. Let's put it that way. So the central issue that comes out of this, all of this community life data, is really about unemployment and underemployment. And it's nicely encapsulated in this idea about the handout syndrome. So CFK is very, very unique in that it does not provide financial reward for participation in their activities. So most of the organizations in Kibera, of which there are hundreds, give financial rewards for people to come to their activities. So you come to my show, my theoretical show about HIV, then we hand out money. So this is because people know that CFK doesn't do this. It's very difficult to get people to go to CFK activities. So, but CFK has kind of made this decision early on, so they're not gonna do it. And this quote here really shows that people really think that NGOs just are made of money, and they're just throwing it out there. And if they go to an event with an NGO, they should expect some sort of financial gain. And that's really what they're looking for. And I have lots of data about people thinking that communities dependent on NGOs, things like that. These are some exciting examples of adaptation. The most exciting one, or interesting one to me, is post-election violence adaptation. I don't know if you guys remember, but early 2009 there was a massive outbreak of violence and in Kenya right after the election, and a lot of this took place in Kibera, which was in a lot of tension. It's right in the city center, and lots and lots of people were killed and homes destroyed and things like that. So the program basically had to shut down for 9 months and start moving into emergency procedures like providing emergency contraceptives, training on gender-based violence, and then post-abortive care. They don't, just for clarification's sake, CFK does not provide abortions because it's illegal in Kenya, but they provide the care for after if women are, have some sort of complication because their abortion wasn't safe. So, as by way of, well, I was just going to say, part of the emergency procedures, interesting thing too is they had to shut down all their HIV testing because they moved everybody into like a temporary camps. And if you think about a slum, which is already very temporary looking from the outside in, and to have temporary camps even within the slum is a very kind of intriguing idea. And they were doing HIV testing, and the program officer had just pricked somebody's finger to do an HIV test, and somebody fired a gun right next to him, and he startled and nearly pricked himself with the same finger, or with the same needle. So this kind of, because this was super, super dangerous, they had to close down all their HIV, mobile HIV testing, things like that. So this really shows that CFK really has an ability to adapt to the needs and do the events that are happening around them. So by way of discussion, I kind of framed it as implications for both practice and CFK, and then a set of recommendations for the organization itself. So we're going to think about benefits in terms of what's good about using this model of CFK and what's working well, and we're going to think about barriers in terms of what is not working well and what is the drawback of using this model, particularly at CFK. So benefits really are that they're creating leaders, there's a lot of integration, understanding that sexual health really isn't just it really needs to be dealt with in a comprehensive manner. Like, you can't just give somebody an HIV test. You have to, tell them about sexual health. You have to educate them about all these things and address, like, if there is violence going on at home and maybe they're pregnant, and like all these things kind of come with sexual health. So approaching it in a very integrated kind of way. The identified health behaviors that we found in this study really back up the use of peer educators, and really is community driven. The barriers to using this model at CFK include like unmet expectations of peer educators, like we went through here. Monitoring evaluation, of course, was not very good. And they also have a lot of diffuse responsibilities. So CFK, like many organizations, is very communal, so very familial. So people are kind of expected to do whatever is needed. So the peer educators themselves are very stretched, very thin, even across programs that aren't their own, which makes tracking their input very difficult. And then there's a set of operational issues that we already went through. So implications for practice include a number of things, including clearly defining the benefits so that the peers understand exactly what they can expect from CFK and what CFK's priority and capacity is to serve the peer leaders, that they need to react to context, like context dictates adaptation, and that they need to react to this in a structured, non-reactive kind of way, that the peer educators are community members too, and this is and making the peers understand that they represent CFK even in the community, and that people understand it. It really kind of, if they're not doing what they preach, then that really can impact the entire program, even the entire organization. The lack of monitoring evaluation, of course, is a tricky thing, and then keeping the peer educator model in line with the organizational agenda is important. As far as implications go for CFK itself, the peer review model really is theoretically appropriate for this setting and for this organization, in that, like I said, that adolescent sexual behavior really fits into this model. They really show adaptability to the context, and they show fidelity to organizational priorities of both the youth development and the creation of leaders and the community-led development. But of course, there's always things that we can do. So I created this pretty lengthy report of recommendations for Carolina and Kibera on this matter in particular. And these have been workshopped and worked into their 2012 plan and for the next 5 years of this particular program. Very briefly, they include things like defining roles and activities and success and objectives, and at the very least in an effort to start to measure things. Clarifying leadership and decision-making structure, involving the community further. This could be in terms of doing a needs assessment or getting feedback or somehow gathering community ideas about what their program is doing well and what's not doing well. And then strengthening the role of peer educators and understanding that they're also community members and they can give a lot of feedback. And retraining and training again. And then doing a tracked volunteer experience for the peer educators is also important, and that they only can serve 2 years, because a lot of people talk about how once you get beyond 2 years, they really can't. They just get kind of complacent and grumpy and really need to be phased out of the program, and they even get dependent on CFK. That they can utilize existing resources in terms of partnerships especially, and engage in purposeful monitoring and evaluation. So of course there's some limitations and challenges to this research. So the challenges that, to my research in particular, are similar to the challenges to the program. They include things like, it was really difficult for me to get girls to participate. It was really difficult for once people understood that I wasn't going to be paying them anything, for them to come and get interviewed. So these kind of things also impact your research. So when you're thinking about things that are happening in the community, they'll also happen to you when you're there. And incomplete documentation, of course, is a big challenge. Like I said to Sydney before, when I went in, I originally wanted to do this big process evaluation, but because there wasn't the documentation to back that up, I wasn't able to do that. So that kind of swayed the project in a different direction. And then, of course, limitations include things like generalizability. You're working with just one organization, and that's the whole purpose of the project. Then, of course, you're going to limit your generalizability. Like lost data, so I transcribed all of my data myself, which, of course, it was all in English, but very, very broken English. So there could be a lot of lost data there because it was very difficult to transcribe myself. And then, of course, researcher bias. If you do triangulation and one of your methods is researcher participation observation, of course you're going to have researcher bias. So thinking about what's next is primarily about monitoring evaluation. And I'm continuing to work with CFK to do a lot of these things. And other parts of my project beyond this included things like workshopping all the monitoring evaluation tools, reworking all of these objectives, really talking about the future, and really talking about how from now on we can really start to measure things and making these more a productive effort to do so. So in conclusion, really, this particular paper just says that this is a really good model and really good fit for this organization, but that there is a lot of work still to be done, and that CFK really is doing a lot of really good work in the community, and that they're awesome. So I just want to give shout out to DGHI, Kim Chapman-Page, who was my thesis mentor, Dr. Whittle, who was on my committee, and Sandra Canfield, who is not associated with Duke, but an all-star nonetheless. Carolina for Kibera, of course. The PYE is here, and then the SRH staff, especially Ben, who is the main staff person I worked with. And that is that. Do you guys have questions, logistics questions or project questions, or, yeah? Go ahead.
I have actually a couple questions that are completely unrelated. The first is, did you come up with a reason why girls weren't participating? I could see hypotheses for that, but...
Well, I think there's a number of things. The girls are expected to help out at home a lot, so they're at home quite often. They are also, it's a very male-dominant society, so even in politics and things often you find that men speaking a lot more. So in a group setting when there's males and females, often the males dominate the conversation, and you really have to work to get the females to talking. And as a moderator and as a facilitator, like, that can be your job. Like, you can think about ways to get the girls talking. But this kind of backfired me in a couple ways. When I had a focus group and I was like encouraging the women to talk, I said something to that effect, like, okay, girl ladies, like, what do we think on this side of the room? Of course, the women all sit together. And then the men decided they were all going to tease the women about not speaking because they were silly or like didn't know the answer and all this stuff. So it kind of backfired in my direction. So you have to think about that, like a nice way of getting the women to talk.
And the other question I had was about getting people to come and participate in your interviews. Would you have, looking back, would you have maybe changed that and provided some incentive? And if so, what would that look like for your larger costs?
So I provided refreshments, so like tea cakes and tea and bananas, because you can't really do anything in Kenya without providing tea, anything. So I did that. So there was refreshments, but there wasn't monetary, and that was really difficult. Like, people just didn't want to come, like, or they would come and they'd find out and they would just be grumpy and sit there. So I don't know. For me, it was in keeping with my partner organization. That was kind of their standard operating procedure, was to not provide these financial incentives. So for me, it wasn't as much of a choice. But you get different people when you provide financial rewards than you do if you don't, which is something you have to think about too. So I don't know that I would. I mean, it definitely was awkward for a moment or two when they got to the end of the interview and they were like, "Where's my lunch money?" And I was like, "Here's your soda." So, you just kind of think about how that's going to play out. But I spent like $50 for all of my incentives altogether because tea and, because I only provided refreshments at the focus groups and not at the interviews at all. The interviews, they came, they saw my face, they left, that was it. Thanks for your time. I bought some soda sometimes. Those are like 10 cents.
Question about like the recommendations.
Sure.
Can I give those recommendations to like staff?
Yeah.
It wasn't like necessarily to peer educators, but it was their.
No, not at all. So
Okay.
the peer educators were all consented. So when I consented to the peer educators, they all understood that like eventually their remarks would get back to the staff, but that they wouldn't get back to them like so and so. This girl thinks this. So they knew there would be recommendations coming along down the line. So the actual set of recommendations went to the head of the health department and then the program officer himself. And it's interesting when you work with a organization, like you don't want to step on any toes by like giving like recommendations that might upset, but you have to be honest and you need to like be thorough. So yeah, I left their choice of whether they were going to share that information with up to the program staff.
And so I was wondering, like, do you have, like, if you had to pick like one or two key behaviors that the staff needed to engage in to sort of implement, like, some of what you, like, what would have been the best? Because there's a lot, and I was just wondering, like,
Right. So I think like providing feedback on the stipend issue is really important, and the like clear set of benefits that can be expected from the program. Like, some of them were expecting to get, because like 3 Mzungus showed up every summer, like 3 white students showed up every summer to help them, they would someday be able to go to America, and so, which is not necessarily a realistic expectation. So being very clear about this is what is exactly going to happen to you can be really helpful. And then also communicating to the peer educators that they represent CFK within the community, even on their off hours. That's really important.
That's a pretty good, solid, behavior changes that they can address right now.
Right. So when I gave them the recommendations, I left it very, very vague, because I'm not trained or in the position to create like, here's exactly how you go about making all these recommendations work for you. And because it's very community-led, like CFK, like all of their staff is Kenyan, about half of them come from Kibera. They only have 1 U.S. employee, and she was here earlier. Like, so I left the recommendations very vague, very open, very interpretable, so that they were able to create their own policies and their own programs from those set of recommendations themselves and how they see fit for their particular needs and wants and organizational ideas. Yeah. Any other questions? You guys all know how I do all this? I don't. Yeah.
What's next for you then?
So I'm going to try to find a job. So I'm graduated officially, and I'm doing the job search, and I'll be here in the area. So what I'm doing. Where I really like to do program stuff, but what program stuff means is very, very vague and broad and open and interpretable, so it can lead to all sorts of different things. I like, if you're going to work with a partner organization, I think, just in general, I don't know if anybody working with partner organizations that they know? Nobody? Okay, never mind. Leave my comments at home.
Please share.
What?
Please share.
Okay, I was going to say, like, if you're going to work with a partner organization, I think it is a little bit of a balancing act because you have to decide what your priorities are, what Duke's priorities are, and what their priorities are, and that can often lead to a conflict of interest, and that can often lead to some discrepancies and expectations. So just like we were recommending that the staff was very clear about their benefits, like making sure that there's kind of that understanding and collaboration can be tricky. And like I said, like I had to change my project when I got there pretty rapidly, and because you're there and you've got 10 weeks left, and oh my gosh, so having that kind of relationship, if you can, going in is very difficult, to be honest, but pretty necessary.
Yeah, this is sort of going back to when you were talking about like almost 2/3 of the girls weren't necessarily sure that their sex is consensual.
Yeah.
Is that something that the peer youth educators were trying to talk to their peers about? Or?
Yeah, so they're trained in like one-on-one kind of talking, and talking. Of course, like things like self-efficacy, like being able to say no is a very difficult topic and not a very teachable one in a large group setting. So these are kind of topics that they dealt with on this kind of one-on-one communiques, like establishing a relationship with someone, like a friend that is able to talk to you about these kinds of things. Whether or not like that is going to impact is, disputable, but because like a lot of other places, there's a lot of gender-based violence. A lot of girls seek older boyfriends, twice their age, because they have money and they're stable, and then that kind of thing. Maybe that's a good example of how they're undecided about the wantedness, because they kind of chose it. Yeah, they said yes when the moment came, but perhaps they sought out the relationship for a different kind of reason.
On that note, I remember on the slide it said that like only 60% of the guys wanted it. So
yeah. So I
just kind of thought guys were the ones pushing for that kind of thing.
They might have felt pressure to do it, maybe.
Or there's actually
guys also have relationships. They're like in Kenya with older women and teachers. Published.
That seems very substantial, right? It seems very close to the.
Yeah. 60% said that they did want to have sex the first time they had sex. And about 30 are undecided, about 10% didn't want to have sex. But that's still 10%. You have 10% basically saying. And here is interesting because, I don't know if you can see this, but here is the motivation for first sex. And for men, the vast majority is curiosity, which often you can think about that in terms of peer relationships, in terms of peer talking, right? Like, I heard this was fun, or my buddy said this was the thing to do. Like, curiosity about what your friend is talking about really can drive that decision to make. And that is a substantial thing. So here we have, like, this was partner insisted, would not take no for an answer. 13% men and 34% girls. Also, you find that young women who are like 17, 18, 19, and Amy mentioned this last week, really like to have babies. Like, that is a status thing, and they're very positive about their pregnancies and very positive about having a baby. And like the two peer educators that I interviewed that were pregnant and had babies, were very excited about it. Like, this was their moment. It was their time to be a woman or to be a mother, and they were 19 years old, and they had graduated from secondary school, and so they hadn't dropped out of school, but. They actively made that choice to have kids.
Are there any other groups in that area that are specifically dealing with sexual violence?
In Kibera?
Yeah.
I'm sure there is. Like, Kibera, because it is like the largest slum, really attracts a lot of organizations, some more legit than others. The CFK staff will tell you there's about 10 legit organizations, but there's probably like 600 or 700 on the books. So I'm sure there's a lot. There's the USAID actually had just run a big campaign. I don't have a picture of it in this particular show, but they just ran a campaign that was like a speak up. They call it CTAquino, which is like won't keep quiet. So they had like all these different like plastered everywhere about not you get raped and please speak up. So I'm sure there is. And like I said, like if you're more interested in like in Carolina for Kibera, it's a very cool organization, and the website's very thorough too if you're more interested in that. Any other things?